Welcome back. Legalizing marijuana in Connecticut, a bill to allow pot for recreational use, is once again up for debate in the General Assembly.
Just this past week, in fact, there was a public hearing on the issue with strong opinions expressed on both sides. The proposed legislation would allow possession of up to 1.5 ounces of marijuana if you're 21 or older. And yes, Connecticut, of course, is going to tax it, and that could mean millions and millions of dollars in additional revenue for the state. Another interesting element of this is a provision for the payment of reparations to those who were impacted by the war on drugs.
Joining us this morning, State Representative Raheb Ali Brennan, a Democrat of Bethel, and Deputy Minority Leader in the House, Representative Vince Candelora, a Republican of North Branford. Glad to have you back.
Thanks.
Welcome to the program.
Thank you for having me.
You're a freshman legislator, right?
I am.
How's it going so far?
It's good. I'm a freshman, but not a rookie. I'd say that.
Okay.
I want to ask you, the supporters are saying it's just a matter of time before we have to address this. Why is it just a matter of time?
Well, I mean, we're dealing with this now. I think this has been an issue we've been debating for years, but the reality is people are using cannabis today. So, it's up to us to deal with the issue. This is a public health issue and a public safety issue, and prohibition has not worked.
You had sent in and testified, a written testimony, right, in support of this bill for this public
Correct.
hearing. What was your main point there? Why do you think that we should pass it now?
Well, this is not something that I campaigned on at all. It's an issue that we see, though. It's our job as legislators to tackle the issues and have the hard discussions. And, I brought this issue back to my district, had a community conversation, and the biggest issue is with people being on the roads. Will we see a spike in that? But the reality is people are already smoking and using this on the road now, and we could use money to invest in drug enforcement officers that can basically tell if someone's been smoking or if they've been using prescription drugs, which would help with the opiate epidemic.
Or if they've been smoking and drinking.
Yeah.
That's right.
We don't have, how are we going to police that?
Yeah, I mean, it is one of the big concerns. It's why our chief of polices have come out against the bill. There isn't a test yet to really determine when you're intoxicated under or impaired under marijuana. It is really a personal sort of analysis. In Rhode Island, the courts have thrown out drug recognition officers' findings when someone's driving. So it is an issue that really has been one of the causes that stops the legislation from going forward.
One of the things I was reading that this attorney who worked on the Massachusetts plan was warning Connecticut about is to not order limits on the products or any bans on home cultivation.
Yeah, I think one of the parts of the conversation that we should be having is not legalization, but commercialization. So the big push for marijuana, one of the concerns is commercialized products becomes like big tobacco. And we see where there are no limits on the THC levels, the types of products that are produced inevitably get marketed to children. We see the gummy bears and the sodas and the cookies and candies that come out. And that's sort of part of the conversation. There's discussion about a Vermont-style model where if you're doing it, if you go to a homegrown type of method, it is safer because you don't see those potent high THC levels that's leading to all the societal ills.
Do you think that this? Oh, go ahead. You have something to say? Yep.
No, I think the whole purpose of this is that we're regulating the product. A drug dealer can't recall their product. The state can, and it's making sure that it is safe. And we didn't see an increase in teens in Colorado using marijuana, and we saw actually an increase in teens graduating from high school. So the fears, I feel like it's kind of people are skewing the data, and that's not really the case here.
How many states right now in New England, Connecticut is thinking about it, Massachusetts has it.
Yes.
What's their experience?
So there's 11 across the nation, but it's all different. We have Vermont, and yeah, exactly. I mean, New York is looking to implement this, and it seems like they're really going to get it done this year. So we have to ask ourselves, if someone can travel 20 to 40 miles to get this product, we have to get ahead of it and make sure that we're doing what we can to regulate.
Why do we have to get ahead of it? It's just because other states are doing it.
Well, it's not even getting ahead of it. It's happening now, so we're already behind.
But if we're behind and people feel we're safer that way.
But we're not safer. I think you're seeing that with the opiate epidemic, that some of this product is laced with fentanyl. So why not have people use a safer product? You saw that with vaping. Most of the cases of the people that were vaping and getting sick was because it was from black market. So when we have safer product, people aren't getting sick and people aren't dying.
Vince, I'm curious, the medical marijuana industry here in Connecticut is highly regulated. I mean, I've been in a couple of their grow facilities,
right.
And it's a very professional environment, obviously. What do you think about our medicinal marijuana program.
Yeah, I mean, I think that program is a leader in the country. You know, we're one of the only states in the country that has FDA approval to research the drug for medicinal value. So Connecticut is poised to do some really great things with it. I believe commercialization will decimate that market like it's done in every other state, because you will have these commercial products just coming in. The thought that just making it more accessible to people, that somehow we're going to be able to better regulate it, is very dangerous. I'll tell you on an anecdotal note, one of my community's surveys, their kids in Guilford, they survey the students in school. They found vaping going down, but THC increasing, marijuana consumption. And they found that children aren't afraid of it anymore the way they used to, because as society, we're embracing this drug. And the delivery models have become very dangerous. You know, we saw people dying from vaping. It was from vaping THC. And children can do it in schools, they could do it in the bathroom, they could do it on the buses undetected. So all of these different products that are being introduced and these different methods of intoxicating yourself with marijuana is the problem. And that's why we should be having a conversation of, let's stop with all these products to make money and let's talk about the substance, the plant itself. If people want to smoke a joint, that's one thing. But to be able to have it in a gummy bear form or THC form, it's very dangerous for our kids.
Well, and I think that's, the money that would come from it, it would go towards education, and we know that that works. To point out this is for adult use, it's not for kids under 21. And we can invest some of that money in recovery, in education, and sending it back to the cities that were most affected by the war on drugs.
Can you talk a little bit about the reparations piece
Sure.
of this bill? Because that's a key component, I feel like.
Yeah, I mean, there's many communities across the nation and across Connecticut that have been hit hard by this, and it's our job to make sure that, those people who are hit hard have a leg up when and if we legalize. And we do feel confident this year that we have a bigger coalition and a broader coalition to get this over the finish line. And the governor's done a great job and stepped up to really put a thoughtful piece of legislation
This would be
forward.
what, payments to people who were convicted of low-level offenses and
It's
did
just
time?
expunging records and making sure that people can have the opportunity to open up a store if they
There's
would
no
like
money.
to. Commercialization.
They're not being paid anything.
No, there's no money involved in this, but it's to make sure that they can have a leg up if we're legalizing something they were punished for.
Right.
Well, Reb and Vin, thank you very much
Thank
for joining
you.
us here.
Thank you
Glad
so
to
much.
have you both on again.
Yeah.
And right now, this is in Judiciary Committee, right? And
Right.
it has not been voted on yet. It will likely have to go to the Finance Committee, I would assume, because of the tax revenue piece of
Probably.
it.
And can I just jump
Sure.
one thing? This is just the beginning process. If this is passed, it would go, the Department of Consumer Protection would have to let us know in 2021 what are the issues they see. And the legislature, we would have the opportunity to work with Republicans and Democrats and the governor's office to address those issues. So we're just trying to get there, and we want to make sure that everyone's part of the conversation.
And if it's passed and signed by the governor, when would it take effect?
Well, it would, right now in the bill, it's 2 years and 3 months. I think we could implement it earlier, but that's a debate for us to have.
Okay.
We're actually out of time right now, but thank you both so much for coming on the program.
Thank you.
Thank you.
And up next, right after a quick break, Connecticut is one of nearly 30 states considering a new bill that would ban discrimination based on ethnic hairstyles. It's called the Crown Act, and a report on that is coming right up. Stay with us.